Good evening, you're watching The Big Story. I'm Kimberly Jiao, coming to you live from the Ministry of Communications and Information. News just in, the Multi-Ministry Task Force has just announced its most stringent measures yet to combat the spread of COVID-19. These include the closure of entertainment venues like bars and cinemas, suspension of tuition or enrichment centres, as well as faith-based activities, encouraging seniors and those with underlying conditions to stay home, limiting of gatherings outside of school and work to 10 persons or less, as well as ensuring physical distancing of at least 1 meter in places like restaurants. These will take effect from 11:59 p.m. this Thursday, March 26. At tonight's press conference, co-chair of the Multi-Ministry Task Force, Lawrence Wong, stressed that these new measures do not constitute a lockdown.
People use the word lockdown very loosely these days, and it means many things to different people. We like to think of our strategies in different categories and based on risk. At the very baseline level, there are things that we ought to do permanently. And even after COVID-19 is over, and it will be over at some stage, we have to maintain these standards. We've said that these measures will be put in place for a month. And if these measures are effective for a month and it helps to break potential transmission chains, we may then come back to Tier 2, where we were last Friday. If these measures are not effective, we may continue them for another month. We could escalate further. Escalating further would then go into the next level of measures, which would include suspension of schools and workplaces.
In light of the recent spike in imported cases, the Ministry of Health will also be putting in new regulations. Those who insist on travelling overseas will have to pay full hospital charges if admitted for coronavirus-related treatments.
There are still about 1,000 Singapore residents and long-term pass holders who are travelling abroad daily despite our travel advisories. These individuals pose a risk to the health of fellow Singaporeans when they return. From 27 March, any Singapore resident or long-term pass holder who disregard the prevailing travel advisory and travel overseas will be charged at unsubsidized rates for their inpatient stay at our public hospitals, should they subsequently become COVID-19 positive. Singapore residents will also not be able to claim from MediShield Life or integrated shield plans for these treatments at public and private hospitals.
Singapore confirmed 49 new coronavirus cases today. Of the 49, 32 were imported. This brings the total number of cases to 558. For more news and videos on COVID-19, do head on to straitstimes.com. I'm Kimberly Jiao for The Straits Times.